Um, so good morning, and it's truly my great pleasure to speak after all these PrEP experts in the region and at the global level. And today, I might not be that optimistic about this question, how to implement and scale up PrEP in Thailand. Nowadays, when I ask this question, how to scale up PrEP in Thailand, that's one loud answer inside my head, which I could not allow myself to say it out loud. But I'm not going to talk about this today, and I will try to sort of pretend that I know some answers. I would give you some good answers of how to implement PrEP. For me, there are two questions here: how to implement PrEP and how to scale up PrEP. How to implement PrEP, I don't think it should be the question anymore. I don't believe that any of you in this room don't have a client who you think he or she needs PrEP. And I don't believe that you don't know how to get that one bottle of PrEP to that client, although it's not free in your country. Although it may not be on sale or for sale in your country, the tenofovir and FTC. You have heard quite a lot this morning that you should be able to guide your client on how to buy it online. It's legal in the UK, and I don't believe that it's illegal in our countries in this region. I would not say it's legal, but it's not illegal. Right? So once I think that what probably holding you back from you starting to implement PrEP in your clinic is probably your mindset. For those of you who haven't really had a chance to start prescribing PrEP in your clinic, many people could not get over the panic, knowing that PrEP allows us to control HIV without controlling sex. And that is something that is behind your mindset, that you didn't really want to talk about PrEP to your clients. So I think once you start implementing PrEP in your own setting, in your clinic, then the question about how to scale up PrEP becomes sensible. And in Thailand, I don't want you to look into the details here, but just to remind you the history. We are the first country in the region to include PrEP in our national guidelines back then in 2014. And then right after we launched the guideline in October 2014, we have the PrEP 30 program at the Thai Red Cross Anonymous Clinic, telling people that it's only $1 a day that you can get PrEP in this country. And now it's half $1 per day. So the program changed into PrEP 15 service just last year. And then we have the next year, 2015, a feasibility study to demonstrate that PrEP can be dispensed safely by KP lay providers and also safely by doctors. And then until now, it's pilot study number 2, number 3, number 4, number 5. You see, and we still couldn't get PrEP into our NHSO. So you get NHSO. And at the same time, the country keeps saying in other global platforms that Thailand has now expanded PrEP to 25 provinces already. So everything like seems good at the global level for Thailand. But the reality is that over 4 full years of implementation, we still have only 5,000, 6,000 people on PrEP in the country. Out of the estimated, this is rough estimation, I would say the minimal estimation of PrEP target of around 200,000 individuals. So it is 2.5% coverage after 4 full years of implementation. This is much, much too slow, and we will not see the herd effect that Andrew mentioned very soon. And then I believe that there are many reasons behind why we only have this 2.5% coverage. And you can see here that among these 5,000 people, more than half of them are getting PrEP through this Princess PrEP program, which is PrEP prescribed by, illegal term, PrEP dispensed by KP providers in our country. And only 10% are receiving or accessing PrEP, the green part here, through the government hospitals. And the rest are receiving PrEP from demonstration projects or fee-based PrEP program. And I'm sorry that I stopped tracking this number since June last year, because I in the hope that the Ministry of Public Health should now have a better way to track this number than myself, and the number should be more accurate than I calling people running PrEP programs in the country and ask how many people are there in your project. So this is just a rough number. But then talking about that largest PrEP service delivery in the country, which is the PrEP dispensed by KP providers, we have been struggled over the past few years because of the frustration or the objections by many professional institutions don't want to allow PrEP dispensing by KP providers to be something recognized as legally accepted at the national level. And at the same time, we have been seeing this complacency at the Ministry of Public Health level. Partly, I believe it may not be true, in order to avoid confrontation with professional institutions. The Ministry of Public Health instead chose to expand PrEP through public health hospitals, asking doctors in the hospitals to please prescribe PrEP to their clients, and also launch new standalone PrEP guidelines for the country. It's just launched in September, October last year, and then hold a series of trainings for all these hospitals in those 25 provinces. But as you can see, if there is no serious action taken to engage key populations in the design of how you should deliver PrEP and then co-deliver PrEP, I don't think that these guidelines and this large-scale training will bring us to see any scale-up in PrEP uptake any soon. And the last point is about the cost-effectiveness data. We have heard from Andrew that it's probably not the cost-effectiveness data that we are waiting for. We're just waiting to bring the cost of PrEP down. But you know, in Thailand, we follow the conventional way of introducing new interventions into our healthcare system. And we have the first cost-effectiveness data of PrEP among MSM conducted by our Thai USCDC team, published in 2017. But very sadly, that's not enough for our NHSO to include PrEP as part of the national guidelines, and we still need this is not the conventional way of NHSO doing cost-effectiveness data for interventions to be introduced as part of the universal health coverage. So from early 2017 until now, we are still in the process of waiting for another cost-effectiveness data to be conducted for MSM, for transgender women, and for people who inject drugs, and for serodiscordant couples. Yeah. So no good news here. But lastly, some good news. We have seen some progress in terms of trying to legalize KP providers, trying to move PrEP into part of the the universal health coverage. Just in the past few months, after we directly engaged our Minister of Public Health and sort of bypassed the lower level teams at the Ministry of Public Health. And we have learned that still local data, the feasibility data, the costing data, the cost-effectiveness data are very useful in terms of advocacy that we will still need to do. Although I would love to say that cost-effectiveness data is not needed anymore for PrEP, but at least you need at least some costing data. And we have seen that by working directly with the minister, we have seen policy commitment that proves to facilitate high-level policy dialogues. There are many meetings happening at the high-level policy people. But whether or not lower-level policymakers sense the same urgency and be sincere enough to move things forward is another story. So I don't think that I don't want to give this talk to discourage anyone on how you're going to scale up PrEP in the country, but rather to point out that there will be these issues, these challenges that you will need to overcome. And by learning from examples from Thailand, you should better prepare yourself and then speed up the PrEP scale up to be quicker than what we have here in Thailand. And the final answer to that question, how we are going to scale up PrEP, I think it is for us to have to be persistent, persevere, a little bit pushy, and remain positive. And I borrow Sheena quote here, to put the power of the pills in people's hands. So thank you very much.